Primary malignant tumours, cancer of the heart, are very rare, but the heart can be affected in cancer in more than one way. Direct involvement of cancer in the heart is usually a secondary deposit from a primary cancer elsewhere. This could be a direct spread from cancer of nearby organs or a spread through the bloodstream from a distant organ, distant metastasis. During direct spread, the outer covering of the heart, pericardium, is often involved first. Other important effect of cancer on the heart is due to treatment given for the cancer. Both medications, chemotherapy and radiation given for treatment of cancer can damage the heart. Hence, it is very important to monitor the heart function while treating cancer. Spread of cancer to the outer covering of the heart often presents with bleeding into the pericardial cavity. Blood collects between the outer and inner layers of the pericardium, the outer covering of the heart. If the bleeding is fast or the amount of blood collected is large, it can compress the heart and prevent proper filling. This is an emergency situation known as cardiac tamponade, which has to be relieved quickly. Otherwise, the person becomes very breathless and blood pressure falls with fainting sometimes. The fluid is usually removed by aspiration under local anesthesia, pericardial aspiration. As there is a chance for recollection, a small tube to drain ongoing collection is placed within the pericardial cavity. It is removed later when the bleeding is under control by treatment of the cancer. Bleeding into the pericardial cavity is documented by an ultrasound scanning of the heart known as echocardiogram. It can be done in the emergency department or intensive care unit using portable equipment in an emergency. Echocardiogram can be repeated after aspiration of fluid to confirm the complete removal. Occasionally, there could be a residual collection in a remote region which could not be drained by aspiration and may need further treatment, which could be a surgery. Echocardiogram is also useful in finding out masses within the heart, some of which may be due to cancer. But the common tumor of the heart, known as Myxoma, is usually not malignant cancer. Still, it can obstruct the heart walls and produce symptoms. Occasionally, a small piece of the tumor may break off and get carried away by the blood circulation. It can get lodged in some important blood vessel and block it. If a blood vessel of the brain is blocked in this way, a stroke with weakness of one side of the body can occur. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.